Earlier this morning, the World Health Organization gave us an update on the state of COVID-19. At the high level, I was very disappointed in this meeting. First, I'm going to start with the positive highlights of the meeting and then talk about my critiques. The first is the acknowledgement that not all countries are currently reporting to the WHO, and that the World Health Organization's wastewater surveillance data has a lag of about 2 weeks. And because of this poor reporting to the World Health Organization, it's hard to estimate the true prevalence of COVID infection throughout the globe, where they currently estimate that the worldwide global infection of COVID is 2 to 19 times higher than what they actually report, and that while the wastewater data reporting is poor, the vaccine reporting rate per country is even more abysmal, in addition to variant tracking. And there's a large disparity between high-wealth countries and low-wealth countries in terms of vaccine access and equitable access to the vaccines, where these larger countries, the high-wealth countries, are actually hoarding vaccines and low-wealth countries are not able to access these in a timely fashion. The World Health Organization also acknowledged that COVID is still around, it is still a global threat, that we are at the 4-year anniversary of the Public Health Emergency of International Concern Declaration for COVID, and that we are in year 5 of COVID. However, they then followed up to say that COVID is no longer a crisis and that we are not in an emergency anymore. So the first part of that is not true. We are still in a crisis. Our hospitals are being overwhelmed consistently for a while now, and that the ending of the FIC, the Public Health Emergency of International Concern, is just the WHO acknowledging that they failed to contain COVID at the onset. So when they say the emergency is over, that's what they're talking about. They're not saying that COVID is no longer an actual emergency. It is still an emergency. They're just referencing to their policy. Additionally, the World Health Organization has adopted the stance that they only want to focus on vaccination globally, predominantly focusing vaccination to high-risk categories. So predominantly what they said was 60 years and older, so older individuals, in addition to immunocompromised individuals, which I think is very poor because in order to get widespread immunity, you have to target an entire population, not just the most at risk. And the most at risk are also the most least likely to develop an adequate immune response to vaccination. So in my opinion, technically we should be targeting the healthy younger population as the majority, so this would be under 60, for getting vaccinated because that's going to ultimately protect the immunocompromised and the elderly. And they also mentioned that people in those groups should get a vaccine every 6 months. The WHO also announced the launching of a new dashboard for COVID. And what's quite unnerving is that when I scroll through this, I was looking for the United States, and I do not see us reporting to the WHO. Moving on, the most important statement I felt they made was that healthcare workers need to be provided with standard training so that they have access to the most up-to-date information, the most up-to-date practices, and the most up-to-date standard of care. These were the 5 metrics that the World Health Organization says they're focusing on. So collaborative surveillance, we know that people are not reporting to them. They said that at the very beginning. There is a very large lack of emergency coordination and therefore community protection. Vaccines are not being distributed equitably, mostly due to things like US patents preventing international development of their own vaccines, where 2 outstanding quotes from the meeting were the best way to prevent post-COVID complications is to not get infected or reinfected in the first place. However, they then throw the responsibility on individuals as opposed to governments in terms of protecting their citizens, where the WHO poses questions such as, what are you doing to protect yourself? Opening up a survey where one of the top answers was nothing, which is incredibly alarming and incredibly concerning. And while they're quote-unquote expert here on post-COVID complications, aka long COVID, really underpinned the severe lack of understanding that the World Health Organization currently has surrounding long COVID, where they're going by incredibly outdated information and they're not staying up to date themselves. Where she mentioned that the current prevalence from what their numbers from pre-Omicron are at 6% prevalence of long COVID. So taking a step out and thinking, oh, all right, what was pre-Omicron? That was late 2020, early 2021. We're in 2024 now. We know that the prevalence of long COVID is much higher and that this increases with increasing number of infections. Or if you're on your 4th infection, your prevalence for long COVID sits at about 38%. Additional misinformation by the World Health Organization included their statistics on children, They're saying that long COVID is incredibly uncommon in children, which we know is not the case. Reports by Canada have shown that the prevalence for long COVID in children is sitting at about 33%. The World Health Organization also provided misinformation surrounding the risk for long COVID. They said it was predominantly only in severely infected patients, people that were hospitalized. And we know that people that are asymptomatic or have mild infections can also develop long COVID. This has been well established. And then they further misinform the public, the global public, by saying that most people recover, on average, within 4 months of long COVID. Where most recent information from Canada, again, is showing that almost half of Canadians who reported that they continued to experience long-term symptoms also reported no improvement over time, where nearly 80% had been experiencing symptoms for 6 months or more, and about 42% have 1 year or longer. So again, they're reporting outdated information to the global public, which makes me wonder, why is their information so out of date? How are they not staying up on current literature and numbers? Outside of all of this, I have other critiques. The major one being that they clearly did not consult with the communications department. There were no moderators in the chat, so this person right here, Yoon Buk Song, kept providing misinformation and disinformation surrounding COVID, and nothing was done about it. During the Zoom meeting, there were no captions. I actually was the one that turned on captions for the entire meeting, and they had significant audio issues from beginning to end. So again, overall, this was an incredibly disappointing experience. I wish the World Health Organization would have done better.